Hi, I'm Chelsea Lee with RAD Roller. In this video, we're going to be looking at some diaphragm releases. And to do that, we'll be using the center. So you'll want to make sure that with the center, you have a little bit of the air deflated so it's not super firm. The more deflated it will be, the less intense it will be for your abdomen. So I'll let you decide what would be best for you. Before we get into the release, just want to chat a little bit about the diaphragm. So this is the primary muscle in breathing, and what can happen is that it can hold a lot of tension, and when it does that, it sits low. So the muscle is an umbrella-like dome muscle that has a central tendon in the center. And when it contracts, it gathers in and it lowers down, and that helps you inhale. So it draws the tissue around the lungs down as the thoracic walls expand up, and thereby allowing the lungs to inflate and bring air into the body. So this is an optimal functioning of the diaphragm. However, if it stays low and it's not able to get lifted, then you might find that you have difficulty exhaling completely. We can also see you get pressure bellies, or also a loss in the kyphotic curve in the thorax, and also this sort of tension building in between the shoulder blades, the space in the mid-back. So a number of things that can happen, and if you know that you have a tight diaphragm or a diaphragm that sits low, then this could be a great way for you to help rehab or treat that. So we'll use the center. You're going to start by lying on your right side. So we'll want to get into the lateral, anterior, and posterior fibers of the diaphragm, since it does go front to back and side to side. So we'll start lying on your side. Below the ribs is where you'll place the tool, resting on your elbow, maybe all the way down, depending on the level of intensity that you're wanting to bring into this. And letting your whole weight sink in, just breathe. So you can rock side to side slightly. You can also pin and hold and just sink in, depending on how long it's taking for your tissues and everything to kind of soften and let go. You stay here for about 3 breaths. Really important, obviously, to be using the breath if we're wanting to work the diaphragm. One more breath in. Good, full exhale. And keep the tool there, and you're just gonna slide yourself over onto your stomach so that now the center is underneath of the ribs, nice and high up in your abdomen. And you'll want to nestle it in there and try to sink your whole weight down. So you're kind of a little bit more to the lateral side of center. Couple more breaths. Again, you can relax your chest down, maybe come onto your forehead. Good, creating some small movements. Sliding the ball over towards center. You can walk your legs around. Good, allow it to come over to the left side. And sometimes it can take a little bit just to kind of find the right positioning. Once you find it, you know it's quite tender, but it shouldn't be painful so much so that you can't breathe or that you're really wincing in pain. I can feel that this left side is quite a lot tighter than my right side. It's a lot more tender. And keep coming over. Now we're going to move to the lateral side on the left. So again, underneath of the ribs, right into the side body, also helping to release into through the obliques there. And gentle, small movements for one more breath. Good, and then you're gonna lie down on your back and Take the ball just into the lower back here, so below the ribs. Now the diaphragm connects into the lumbar spine, and there's a ton of muscles over top of it. So not really necessarily going right for the diaphragm here, but more releasing the erectors as well as the lats, but it'll all help. If we have too much engagement in through the back body, it can pull the ribs into posterior rotation, which is essentially then taking us into an inspired state, or the space where the ribs would be in an inhalation, which again would make it difficult to exhale completely. So I'm just rocking my hips side to side because that feels nice, but you might also find that you like to just sort of do some pelvic rocks, tilting the pelvis up and down. If you've got the RAD Helix, you can also use that, or a RAD roller would be nice for this as well. Again, a little bit more of a intense option as they're denser tools than this soft center. Okay, once that's done, set the tool aside, come up to sit. So for stretching the diaphragm, kind of a challenging thing to do, but one tool we have through Hatha Yoga is called Uddiyana Bandha, and this is essentially an abdominal lift. The first thing you need to be able to do before you can actually practice Uddiyana Bandha is a lateral costal breath, and this is essentially side body breathing. So just in a seated position, you'll take your hands onto your ribs, either as I am, or if it's more comfortable, you can cross the body. So you'll have your hands here just for a little bit of biofeedback, just so you can tell what's going on. I'm going to take a big breath in to the side ribs and a breath out. So you should feel the expansion of the ribs pressing into your hands. Hands also will give you a little bit more feedback in terms of whether you're getting more expansion on one side or the other. So again, a little bit less expansion in one side for me, so I'm going to try to breathe more space into that side. Good. If this feels comfortable and pretty accessible to you, then you can progress into the next stage. If not, just keep working your lateral costal breathing. The lateral costal breathing keeps the diaphragm lifted, and you're using the intercostal muscles and the accessory breathing muscles to help move the rib cage, so that will help to strengthen the diaphragm. If that is, though, more accessible, then let's go to the next step. So you'll come onto your hands and your knees to begin, and turn your palms in slightly, so that will help to protract your scapula, just giving you more space in the back body for the ribs to expand. Knees can be stacked underneath of the hips, toes tucked, untucked, whatever you like. Find a neutral spine to begin, so just make sure you're not collapsing or really rounded. So you want to have the natural curves of the spine. You're going to take a lateral costal breath here, and then a breath out. So to do this next lock, so the bandha is considered a lock or a seal. What you'll do is you'll have a complete exhalation, clear all of the air out of your lungs, and then keep your abdomen really soft. And you're going to lock your glottis and your nose as you almost take like a mock inhalation. Like you won't actually take the air in, but you'll be trying to. So the thoracic cavity will start to expand, creating a slight vacuum, which will then draw the diaphragm up, essentially into length, and therefore stretching the thoracic diaphragm. So it looks something like this. I can't talk while doing it, so I'll just demo. I'm going to take a breath in. Clear all the air. So you hold it for as long as you can, and what you'll feel is this intense pulling up through as the abdominal organs get lifted up. You might even feel a lift in through the pelvic floor. You just hold it for as long as you can, and then allow for a natural inhalation to come in. And you can practice that, repeat it another 3 to 5 times. We want to take this another step further, then we'll challenge you by taking it into a downward facing dog. So going into a down dog, going into the inversion, now we've actually weighted the diaphragm with the abdominal organ, so you'll actually get an even deeper lengthening. Best to practice it in 4-point kneeling or even standing if you like, with your hands on your thighs, as that tends to be a little bit easier when you're first learning this technique. So I'll just demonstrate from a downward facing dog. Allow your knees to be bent so that you can have a natural curve in the spine. So just like in tabletop, you want to avoid any rounding or compressing in the low back. So nice long spine. Breathe in. Clear all the air out. Sometimes it helps if you purse your lips and imagine that you're blowing up a balloon. So give it a try. Any of those variations, what you'll feel is nice stretching in through the abdomen, this lift of the diaphragm, so you actually feel a little bit more of buoyancy and for the breath, as well as a little lightness in the pelvic floor. So enjoy.
For more information, visit radroller.com. For more video tutorials, check out our YouTube page at youtube.com/radroller.